We're going to start now with cardiovascular health. We're going to talk about some of the different heart diseases and heart conditions, just so you have a little bit of an understanding of what they are and how you can keep your old tick-tock in tip-top shape, okay? So when we talk about cardiovascular disease, it's a general term that deals with anything that's affecting our heart and blood vessels. According to the American Heart Association, 1 in 3 men in America has at least one form of heart disease, if not multiple. And more than 500,000 men die of cardiovascular disease every year. That's more than cancer and diabetes combined. So heart disease is still the #1 cause of death, and unfortunately that's both men and women. It's up there. Because cardiovascular disease affects the heart's ability to pump blood and oxygen to our body, it can really have an impact on our daily life. It can affect the things that we enjoy doing. If our heart's not pumping oxygen to our body, we're very tired. Our muscles aren't getting the oxygen in the blood that they need. It's going to interfere with our ability to socialize, to get out, to go shopping or go fishing or golfing. It may affect our ability to play with our grandchildren, to socialize. Things like climbing stairs become harder and harder if our heart's not working right, and even having sex can be affected. Now, that may be something that we're not worried about anymore, but I know plenty of people that still are, and so it can be an important topic. When we talk about heart disease, we want to look at what our risk factors are. The more risk factors we have, the higher our chance of developing heart disease. So I'm going to read some questions to you. You don't have to answer out loud, but I want you to think about these because this is really important for each one of you to determine your individual risk for heart disease. They say that if we answer yes to just one of these questions, we are at higher risk. If we have 2 yeses, our risk quadruples. And if we have 3 yeses or more, our risk goes up 10 times. So as we go through this list, I'm going to tell you at the start, I have at least 3 yeses myself, and I'll tell you what those are. So I want you to think in your own minds as we go through the list. The first risk factor is age, and unfortunately, for like everything else, as we get older, our bodies just don't work the way they used to, right? We know that. So our risk goes up in almost every category. So for heart disease, if you're 45 or older, you are at higher risk for heart disease. So I think that's everybody here in the room except maybe Samantha and Brandon, right? So how many of us are 45 or older? Yeah, see, and I just did that on camera. So now everybody that watches this is going to know I'm older than 45. If we have an immediate family member that was diagnosed with heart disease or high blood pressure before the age of 55. So I told my last class, my mom had her first heart attack when she was in her 40s. So for me, that's a yes, because somebody in my family, an immediate family member, mother, father, sister, or brother, had heart disease before the age of 55. If we're African American, we're at higher risk. If we get little to no exercise. Now I know here Sam does great classes with you and you have a lot of chances to do yoga and Tai Chi and different exercises, but we need to look at kind of on that scale, are we getting mild, moderate, or are we getting enough exercise? So if we get little to no exercise, that increases our risk for heart disease. If we're overweight or obese, usually they say overweight is about 10 pounds over our target weight. Anything over 20 pounds, they consider obese. So if we're overweight, our risk for heart disease goes up. I eat a lot of salty foods or I add a lot of salt. Now I know here Chef Ken is wonderful and he probably doesn't cook with any added salt, but sometimes I see we're shaking the salt on at the table. So if you have a high sodium intake diet, it increases your risk. If your cholesterol is high, now this is another yes for me, this is another risk factor. When I was in my 20s, my cholesterol was over 300, which is really high. And it turns out, they found out it's just heredity. My body makes a lot of cholesterol, so I really have to watch the things that I eat, and I need to eat enough of the good things that help get rid of that cholesterol. So remember we talked about how many risk factors, that's already 3 for me. If we smoke, we're at higher risk. if we have high blood pressure, we're going to talk a little bit more about high blood pressure. Number one risk factor, heart disease, heart attack, strokes, high blood pressure. I think we get used to it because so many people have it. I've been a nurse over 20 years working with the senior population. I bet about 85% of the people I see are taking medication for high blood pressure. So it's very commonplace. We don't think a lot about it. We're like, well, I don't really have any chronic illnesses. I just have high blood pressure. High blood pressure is pretty significant, as we'll talk about. If we're using any illegal or recreational drugs, if we're under a lot of stress. I don't know how many of you were at my stress management class, but we talked about stress causes a lot of implications on our health and on our body. And one of them is it puts us at higher risk for heart disease. So managing our stress is really important. If we drink more than 2 alcoholic beverages per day, now that's for men. For women, they only recommend 1 drink per day. And when we talk about a drink, they mean a 12-ounce glass or bottle of beer, a 4-ounce wine glass, or like 1.5 ounce, a shot glass of something like whiskey, more hard liquor. So if your doctor's told you you can't have anything to drink because of other medical conditions or medications, I'm not saying that you're okay to drink. You always follow your doctor's advice. However, if you don't have any contraindications, no more than 2 drinks per day for men, 1 drink per day for women is what's recommended. If we drink a lot of coffee or caffeinated beverages, so soda that has caffeine in it, caffeine is a bronchodilator. It opens up our blood vessels. It makes our heart rate speed up, makes us feel good, and it helps us wake up, but that can be damaging to your arteries and your vessels. So if we're taking in a lot of caffeine, it puts us at higher risk. If we have diabetes, when we have diabetes, especially if our sugar is poorly managed, that excess sugar in our blood can damage those vessels, vessels in our heart, our eyes, our kidneys. So it's really important if we're diabetic that we're keeping our sugar managed. And as we said, if we're taking medication for high blood pressure, it puts us at higher risk. So out of that list we just went through, we really need to look at that list individually and try to decide and talk with our doctor about what our risk factors are. Now, all of this is in your handout, so you can take this with you and you can kind of look at it in the privacy of your apartment tonight. Maybe put a little check mark next to those things that were yeses for you, and that way we can talk with the doctor and say, are these things that we can change? We can't change our age, unfortunately. I think everybody's searching for a fountain of youth, but nobody's found it yet. But some of the risk factors we can change. Even a small amount of weight loss, 5 pounds, can make a significant difference on how hard your heart has to work. So small steps, losing weight, smoking less, drinking less, all of those little things, those modifications can have an impact. So when we say heart disease, what exactly is heart disease? Again, it's anything that affects our cardiovascular system and our heart's ability to pump. The most common is coronary artery disease or coronary heart disease. Those are interchangeable. Sometimes you'll see on your form from the doctor, it'll have your diagnoses and it'll say CAD. That just stands for coronary artery disease. It's the same as saying heart disease. They all mean the same thing. Heart disease can be a risk factor for congestive heart failure, for heart attack, for chest pain. So we want to take that serious. And the most common cause of heart disease is what we call atherosclerosis. Anybody know what that means? That's a big word. Atherosclerosis means we've got a lot of buildup in the blood vessels leading to our heart. So I'm very visual. I like to learn by picturing things and how they look in my mind. So sometimes in your sink, your sink can get clogged. The drain gets clogged and the water doesn't go down as fast as it used to. Sometimes, I know for me it's hair. I get hair, makeup, food gets down the drain. What do we do when the water gets stopped up? We put some Drano down there. Sometimes the guy has to come and he roto-rooters a little bit. Well, think of your heart in the same way. You have these drains, these arteries that go, blood vessels that go, to and from your heart. If they start getting clogged up, and they can slow the blood down, and eventually if that plaque builds up to the point where no blood can get through, then blood and oxygen can't reach your heart. We end up with what's called a heart attack. So very important. What causes it is usually the plaque that builds up mostly from cholesterol and fatty deposits. So cholesterol gets a bad rap. It's actually necessary. We need it. If we didn't have cholesterol, our brain wouldn't function. It helps our nerves function and our brain function, but our body makes all the cholesterol that it needs. So for most of us, it's the amount of cholesterol that's coming in our diet, and we're not doing the effective things to get rid of the cholesterol from our body. So it builds up and it blocks the blood. We can't pour Drano down like we can in the sink. There is a process where they can go in and they can see if your arteries are clogged. Some of you may have had this procedure, and sometimes they go in and they're able to clean some of that plaque out. Some of you may have had a stent put in to help hold a vessel open. But the key is that we want to prevent that plaque from building up. So here's the sad news. They're seeing now in children as young as about 15, 16, that they see the start of that atherosclerosis building up in their arteries already. I think really in the last 20, 30 years, the amount that our diets have changed, the rise of fast food and convenience foods, we're not as active as we used to be, right? For most of you, your grandparents and parents probably worked on a farm. They worked hard all day long. They might have eaten a lot of bacon, but they worked really hard. Well, now we eat lots of bacon and we don't work as hard. So even our teenagers are starting to have the signs of heart disease at a very young age. So education, yes, it is awful. Education's really important. Again, if that plaque builds up, it's very sticky, and as it gets stuck and it kind of clogs that drain, if it completely blocks that artery, we end up with the blood being blocked from our heart. That part of the heart will die. That's called a heart attack. And if that blood flow is not restored, we end up in full cardiac arrest, and that's where people die from a massive heart attack. So it's important that we know the right steps to take. So as we said, cholesterol and fat from our diet contribute to the plaque building up, but there's also a few other things. High blood pressure. Did we hear that before, high blood pressure? I'm telling you, it's a big risk factor in a lot of things. That blood having to pump so hard through your arteries and your vessels over time can be very damaging. Our vessels lose elasticity, they become stiff and hardened, and they can contribute to that plaque building up. If we smoke, we'll have a higher level of plaque. Too much sugar in the blood, if we're diabetic and we're not managing our sugars, all of those things can contribute to having that plaque build up and blocking one of those arteries. So as I said, cholesterol gets a bad rap. It's not all bad. So I want to talk to you because you may have heard there's good cholesterol and there's bad cholesterol. Have you guys heard about that? Yeah. But a lot of people aren't quite sure what that is. We go to the doctor and he does blood work and he says, well, your total cholesterol number is this, but your good cholesterol's too low. What's the difference? So again, I'm very visual, so I like to, how can I think about this in a way that it makes sense? The cholesterol flows through your blood in little packages. Think of them as little presents, little boxes. I like to think the bad cholesterol has a black bow on it, and the good cholesterol has like a nice pink bow. Okay, so those little packages are called lipoproteins. There's two different kinds. There's low density and high density, LDL and HDL. The LDL, the low density lipoprotein, is what we consider bad cholesterol because it helps contribute to other fatty deposits clogging together and building up and forming that plaque deposit in your vessels. So the bad cholesterol kind of attracts more cholesterol and more fat to it. The good cholesterol, the HDL on the other hand, it's almost like, are you familiar with the Pac-Man game from years ago where the little guy comes along and he eats the dots? It's kind of like that. The good cholesterol comes along, it attaches to the bad cholesterol, and it helps us eliminate it from our bodies. So we want more of the good cholesterol so it can help get rid of the bad cholesterol. Does that make sense? So what we want is our good cholesterol number to be high and our bad cholesterol to be low. On your next page, we've got your total cholesterol numbers, and these are just targets. They really would like to see our cholesterol below 200. That's ideal. 200 to 239 is considered borderline high. The doctor may have you make lifestyle changes, add some things like fiber to your diet. May or may not start you on cholesterol medication. 240 and above is considered high, and at this point the doctor would probably start cholesterol medications. Now, one of the best ways we can increase that good cholesterol and help get rid of the bad is by adding high fiber foods. That helps as well to attach to the cholesterol and eliminate it from our bodies. So whole grains, your whole wheat bread, your bran, oatmeal, especially those steel cuts, those raw oats. The more whole grains, brown rice, legumes, and beans, the higher fiber content in our diet, the more it will help eliminate that bad cholesterol from our blood.